started thinking too, because we'll go ahead and start going into fluid balance. I'm gonna work on trying to make either a video kind of explaining, re-explaining things, or like a handout to help kind of break stuff down, to help you look over it and review it and clarify a little bit better. Okay. All right. So we're going to move on to fluid balance. And I actually don't have the same PowerPoints that you do, so I might have something that you don't, because these are my old PowerPoints. I haven't printed off the new ones. So, all right. Let me see what it actually. All right, so first off, we have just kind of a review. You guys know with homeostasis that is required. It requires your body's fluid volume and composition to remain within normal limits. So whenever there is a alteration or a change in your fluid level, depending whether it's inside or outside a cell, your body is constantly changing and adjusting to that. We'll talk about gains and losses. And your gains, so whatever you take in, which would be like your foods and your fluids, those should equal your losses. You have two different types of losses. So your first is what we call insensible loss. And these are things and fluids that you cannot measure. So this is going to be things like sweat through your skin, or you know, when you exhale, you have that condensation that comes out when you breathe and when you talk. So that that moisture is considered a loss, but it's not anything you can see or measure. And then we have sensible loss. So that's the fluids that we lose that we can actually measure. So that's going to be our urine, our stool, any kind of fluid that comes from wounds, or our gastric content. Okay. So whatever we take in, it should equal pretty much what we put out. Okay. So where are all these fluids at? We have intracellular fluids, and that's going to be fluid that is inside the cell. And we have extracellular fluid. So that's going to be made up of three different parts. First, we have your interstitial fluid. And that is going to be your fluid or water that surrounds the body's cell. So that's the fluid outside of the cell. Okay. Then we have intravascular fluid, and that's going to be your fluid that is within your blood vessels. So your arteries, your veins, and your capillaries. And then you have transcellular fluid, and that's in specific compartments. So that's going to be like your cerebrospinal fluid, your synovial fluid in your joints, and GI fluids. Okay. All right. So when we're talking about fluids, we look at whether we have just enough to, you know, where we want to be, we have a deficit, or we have an excess. Okay. So the first one we are going to look at is fluid volume deficit, or dehydration. And I am going to go back to my board here. All right, so fluid volume deficit, or dehydration. All right, I love this little picture it gives. I think it gives a really good visual. All right, so we're going to talk about three different types of dehydration, okay? You didn't know there were three different types, did you? All right. So fluid volume deficit, dehydration. There's 3 types. So the first one we're going to look at is isotonic. And that's going to be your most common one that when you think of dehydration, that's the one that it is. Okay. So isotonic means equal. So your fluid level, fluid lost only from your extracellular fluid, your intracellular fluid stays the same. Okay. I gotta find a better system here. All right. So we're losing all of our fluid that are outside of our cells. The fluid inside of our cells is going to stay the same. So that means our blood cells are going to stay the exact same shape. They're not going to change. Okay. So this is your most common type. And this is where you have a decrease in circulating blood volume. Or we'll call it hypovolemia. So if we don't have enough fluid in our cells to be carrying around fluids and oxygen, that's going to give us poor tissue perfusion. Okay. So what do you think are some common causes of being dehydrated?
Sweating.
Okay, excessive sweating.
Miss White?
Yeah.
Before we go any further, did you say that the intracellular fluid stays the same, or was it intra or inter?
Intra.
Okay.
So inside the cell.
Okay, just making sure. Thanks.
Yes. So if you have your little picture there with the isotonic, your red blood cells stay all nice and round, just like they should be. Okay.
And you're about to go into causes of dehydration. Will the causes that you list be applicable to all 3 types?
No.
So then the ones you're going to go over are specific to isotonic?
Yes. So with isotonic. All right. So excessive sweating. We might have hemorrhage. Or excess, like trauma. Any kind of excess GI losses, like vomiting or diarrhea. If we are really diaphoretic from really high fever. If we have burns. Also diuretic use. And NG tube suction. So when you think about losing fluids, you're thinking of diarrhea, you're thinking of throwing up, you're thinking of not taking in enough fluid or losing major blood loss. Okay, that's your most common what you think of, and that's going to be your isotonic dehydration. Okay. So then we have hypertonic fluid volume deficit. Okay. This is also called cellular dehydration. So when you have hypertonic fluid volume deficit, your cell is looking all shriveled up, like in your little picture here. You've got shriveled up little cells. So it causes shrinking of your cells. So all of that fluid that is inside the cell is now being pulled out into that extracellular fluid. Okay, so the intracellular fluid is pulled out into that extracellular fluid. Okay, and that's what's causing it to shrink. Okay. Some of your causes for cellular dehydration is going to be inadequate fluid intake, prolonged vomiting and diarrhea. I know y'all have not talked about diabetes insipidus yet. But diabetes insipidus makes you pee and pee and pee and pee and pee. So you're losing massive amounts of urine. And then increased sodium intake. Without, an S with a line over it's without enough water. So I think of this with, imagine you're eating some kind of food and somebody put way too much salt on it, and it kind of makes you shrivel up and pucker your mouth. It makes it really dry, right? So that's kind of what it's doing to your cells. It's got too much salt and not enough fluid volume, or not enough water. Okay.
Miss White.
Yeah.
Sorry.
That's all right. People do that all the time.
Would Lasix cause this too?
Yes, it could.
Yeah. Okay.
Yep. All right. So then we've talked about our normal size cell losing fluid. We've been shrinking. So then we look at hypotonic fluid volume deficit. And this is where your cells are going to swell. So your fluid that is your extracellular fluid goes into the cell, or becomes that intracellular fluid, and causes those cells to swell and get huge and puffy. Okay. This is the least common one. you won't see this very often. Its most common causes are starvation, cirrhosis of the liver, TOH use or alcohol use, sometimes cancers, and then renal, heart, and liver failure. Okay. Now, with your hypotonic fluid volume deficit, you have your cells that are swelling, right? So we have to be super careful when we have these patients. Because think if you have a cell that is swollen and puffy, full of fluid, it's only got so much it can stretch, right? So sometimes those cells can burst. Your brain cells are the most sensitive to this. Okay. So you're going to have these patients, if they have any kind of brain injury or brain trauma. Sorry, I was looking at you, Baird. It caught me. You're going to see more confusion and more neuro symptoms in your patients that have hypotonic fluid volume deficit. Okay. With these patients, you're going to see tissue edema, if they have buildup in their abdomen, you might see ascites. Or you might have pleural or pericardial effusions. And those are little fluid pockets. Okay. I really like the little picture diagram because it helps it explain it in my head what's happening to these cells and where the fluid is based on what type of issue or what type of dehydration it is. So if you're hypertonic, you've got the shrunken cells. And hypotonic, they're huge and puffy and swollen because they've got too much fluid inside of them. Okay, so you're dehydrated on the outside of the cell with your hypotonic fluid volume deficit. Okay. Go back. All right. So our risk factors of having any kind of dehydration, and this pertains to all of your dehydrations. Your age is going to have an effect. Your infants and your elderly are going to be at much greater risk for dehydration than your middle-aged person. Chronic illnesses, surgery can, I said chronic, I mean acute. Acute illness can be surgeries. So you've let's say we've lost a massive amount of blood from a surgery. That's going to cause us to be dehydrated because we've lost that fluid volume from our blood loss. Acute illness too, the nausea, vomiting, diarrhea we discussed. burns, you don't have the skin anymore to hold on to those fluids when you get burned and burn the skin off. So you are losing fluids that way. Your chronic illnesses, like I said, liver disease, renal disease, diabetes can also, like diabetes mellitus and diabetes insipidus, both can cause that increased risk of diuresis. So you're voiding more and losing more amounts of urine if you have high blood sugars. Your environmental factors. This little guy down here exercising, so he's got his, he's sweating more. So he's being, y'all, I can't talk anymore. My brain has shut down. He's got profuse diaphoresis, and he's really sweating, so he's losing fluid volume that direction. If it's hot outside and, you know, it's hot and humid, you're sweating more. That's one of your environmental factors. Diet and lifestyle can include things like if you have trouble chewing or swallowing, those patients might not be taking in as much food or fluids in order to keep them hydrated. And then excessive alcohol consumption, because alcohol will make you very dehydrated. You're not getting adequate water intake, and you're peeing a whole bunch. All right. I am actually going to stop right here because I know my brain is fried, and I'm quite sure your brain is fried. And stop sharing.
Yeah.
Yeah. So I will work this afternoon on putting up some more detailed notes and kind of clarifications to help you guys. Because I know this is a lot, and I know this is not the ideal way to learn this on a whiteboard that I'm trying to halfway hold up. Okay.
Thank you.
Any questions?
Miss White, just so you know, Walmart has these giant whiteboards for like $20.
Well, see, I thought that one was going to be big enough, but I don't guess so. But I'm also worried that if I back up far enough that you won't be able to see it very well.
Yeah.
Yeah.
That was my concern. And if y'all would rather me go back to typing, I can do that. It's a pain in the butt to switch back and forth between the screens you're sharing. But I'll do whatever. Because this is a crazy hard unit to try and teach with going back and forth, and I know all of y'all are probably going, oh my God, right at the moment. So I will work on trying to get y'all some better, more precise information. I think handouts and explanations will help tremendously. So I'll work on getting that out to you this afternoon.
Last semester you did the notes where you put your notes at the bottom of each slide, and that really helped. Okay. So I don't know if that's something that I'll send to.
I actually may do that because teaching this online is not the easiest. And I know I give y'all a study guide too. If anybody's taken this before, I give y'all a nice in-depth study guide right before the test. But yeah, I can see about,
Oh, sorry. I was just saying I like this way better. Like it helps for me. Like it works for me.
Okay.
Like hearing you.
That helps with examples and stuff, but I feel like I'm really scatterbrained today, and I apologize for that. So I will work on getting some more detailed stuff to you. Okay.
Okay.
Right. If anybody needs help reading blood gases, it seems to have it down pat. All All right. Any questions? No. All right. Go rest your brains. And I will get you information later on today to go more in depth, okay?
Okay.
Yeah. Miss White,
Yeah.
can you give me your phone number real quick? I was looking for it the other day. I couldn't find it.
It's 704-284